So for question number 1, the different assessments we would do, we would first do tactile location. We'll be testing the median nerve and the radial nerve using this assessment because he reported having a tingling sensation in the middle of his palm and tips of his pointer and middle fingers. It is important to assess this because it's a safety concern for him while he's working with drills. The second test, we would do a threshold pressure test. We would assess this because he's dropped his screwdriver multiple times and has a hard time holding onto his drill when he works on cars. This may show that he has a lack of sensitivity in his ulnar and median nerve. We would also do the 2-point discrimination test because in order for us to know that he has difficulty holding onto tools with his palm and being able to know how hard or soft to grip onto his tools and his drill. We would then do the palmar pinch test. This would assess the strength in his fingers, which is important for manipulating tools and his drill, for working on cars, and for fine motor skills, grabbing onto smaller tools or the screws and bolts that he might have. And he'll also have difficulty writing, as that's one of his hobbies that he likes to do, so holding on to that pencil, having that pinch strength. And then the last test we would do is the stereognosis test. Because he's a mechanic, he needs to be able to identify certain objects in his hands without looking. For example, if he's holding different tools, the different nuts, screws, and bolts from his toolbox without looking at them.
For question 2, we would use the dynamometer because we want to assess how much strength he has to start off with, so he can go back to gripping his mechanical tools at work and be able to manipulate utensils when needing. Since he is a mechanic and it is important for him to have enough strength to hold his tools in different positions and be able to manipulate those tools with enough hand strength, if he is unable to regain strength in his hand, he might not be able to do his occupations as a mechanic at all. And then as far as for his Z-scores prior to surgery, for his grip, it was at a Z-score of -3.2. This indicates his Z-score is out of the typical range, which provides us that he does not have difficulty gripping objects that he uses in his occupations throughout the day. For tip pinch, his Z-score is at a -3.82, which indicates his tip pinch strength is out of the typical range, which is why he is having trouble picking up small screws and bolts at work. For lateral and key pinch, his Z-score is at a -4.57, which indicates his strength is out of the typical range, which provides us that he has difficulty with being able to turn his nuts and bolts using a tool. For palmar pinch, his Z-score is at a -3.69, which indicates his strength is out of typical range, making it difficult for Ezekiel to write, which is one of his leisure activities, what he likes to do on his free time.
So for number 3, we said it would be too soon after surgery. No, it's too soon after surgery, and sessions might injure him more than benefit him. So waiting a few more weeks should be better so that he may regain some more strength and recover from his surgery.
So with question 4, although he does fall within normal limits, coming at a score of -1.5 Z-score, he still cannot be discharged yet. He's still struggling cooking and has difficulty dressing his 2-year-old child. This is something we can continue to work on as he continues to come to therapy. And then his score for the pressure threshold assessment is at a diminished light touch, which is not a concern for his safety, but he might still have trouble with fine motor skills. And Ezekiel isn't ready for discharge either due to the below normal limits for the grip strength, as well as a slight decrease in light touch, which is not a safety concern. He can be discharged after he continues to come to therapy. He notices that his occupations aren't a difficulty to him anymore. So that should complete it. Thank you.
Alrighty, Jeanette. So here we have our patient Ezekiel. You can go ahead and ask him for his
Okay.
basic
Hi.
information.
Okay. Hi, Ezekiel. My name is Jeanette. I'm just a student. So we're gonna be conducting an assessment on you on your grip strength. Okay. So if you could confirm your name and age and your pronouns, if that's okay.
My name is Ezekiel, 56 years old, he, him.
Okay, sounds good. So Ezekiel, so what we're going to be doing is we're going to be assessing your grip strength. So
We're going to be using this dynamometer, and what you're going to have him do is have him in a 90-degree angle,
so you can be
having his elbow tucked in. Yeah. And then what you're going to do is put the dynamometer inside of his hand.
Okay.
And you're going to hold that at the bottom.
Okay.
And then make sure it's set to 0. And so go ahead and have him grip it as hard as you can.
So if you can grip it as hard as you can.
Okay,
Okay, good.
Go ahead and take it out and you can read it.
Okay.
Alrighty.
And then reset it back, right?
Set it back and do it again.
Hard as you can. Good. Okay. Here's the number. So reset it.
0. We want to make sure it's at a 90 degree.
Okay.
Yeah. So there we
As
go.
hard as you can. Okay, good.
Alrighty, let me do the average really quick. So his grip Z-score is at a negative 3.2, which indicates he is out of the typical range. So you can let him know that occupational therapy will.
Okay. So, Ezekiel, when you conducted that assessment, you didn't fall within the typical range. So, we would recommend you to come to therapy with OT, okay? If that's okay with you.
Yeah, it's okay, because I'm having a hard time gripping onto things while I work as a mechanic, so I feel like I would benefit a lot from
Okay.
it too.
Sounds good? Okay, we'll get that started.
Thanks, Ezekiel, for coming back. So today we're going to be working on another assessment. This is going to be the lateral pinch assessment.
Okay.
We're going to be using this pinch gauge right here.
Okay.
And I have my student here, Adrian. He's going to help you out with that, okay?
Sounds good.
So Adrian, what we're going to have him do, make sure he has his thumb pad on the top and then the lateral surface of the index finger right here. Make sure you put this on yourself so it doesn't fall. And have him do that 3 times. You can reset it. And then after that, we're going to figure out the Z-score, and then we'll see if it's within normal.
Sounds good. Alright, so you know, you're gonna use the side of your index here and underneath your thumb, okay?
Okay.
And can you keep your hand at the 90 degrees? Go ahead and go. Sweet. So 2 more times. One more. Alright, so she's gonna be calculating the Z-scores.
Okay, so we'll do the average minus the mean over the standard deviation. We got negative 4.5.
So negative 4.5 basically means you don't fall within the typical range that we want you to be at. But that's not something to be alarmed with.
Okay.
We could work towards that goal as you come here to therapy
Okay.
weekly. Do you have any trouble like zipping up a sweater?
I have noticed that it's
You
been
do?
hard for me to zip it up all the way.
Is that something you would like to work on?
Yeah,
As you come
definitely.
here weekly? So that's something we can write on your chart, and that's a goal that we can work on together.
Okay.
How does that sound?
Sounds great.
Sounds great? Okay, we'll see you next week.
Alright, for sure. Thank you.
Alright, so thank you, Ezekiel, for coming back again.
No
So
problem.
this is my student, Arfa.
Hello.
Alright, so today, Arfa, so we're going to be doing sensory testing with the line filaments. So what you want to do is first you're going to have her put her hand down. So can you have her put her hand down on the surface?
Put your hand down flat on the surface.
And what you want to do is start with the slightest pressure, which is 2.83 level. You're going to want to look for the ulnar nerve. So you want to touch between, try to look for these 2 maybe. Just try to do 1, they don't feel it, 2, 3, until you see like a little bend.
Okay.
Go ahead and do that first one.
Okay. All right. So I'm just gonna be touching this on your hand. Can I have you close your eyes? Right?
Close your eyes as well.
Okay. Can you close your eyes? All right. Let me know if you feel anything. Okay. Just say yes or just say yes if you feel anything. No. No.
Okay,
Is it
so if
okay?
they don't feel anything, they almost 3 trials, you move on to the next one, okay?
Okay.
So the next one is a 3.61. So you're gonna do the same thing again and have her close your eyes.
Okay. So Ezekiel, can you close your eyes for me? Let me know if you feel anything. Just say yes if you feel anything.
Yes.
Yes? Okay. So
Yes.
1 out of 3.
1 out of 3. So it means like she is intact. So we're gonna go ahead and know that she does have sensation in that area.
Okay, but it's a little less.
But it's a little less.
Okay. Alright, Ezekiel, yeah, looks like you just have a little less than what's typically expected for sensation. So we'll work on that in OT sessions, or kind of help you adapt to that. Alright.
That's about it.
Alright, that's it. Thank you.
Thank you.
Hey Marissa, so what we're going to be doing today is we're going to be assessing Ezekiel's pain assessment, okay? So what we're going to be doing is I'm going to show you, okay, in your hand. So we're going to be testing his ulnar nerve, okay? Because that's what he's been having a hard time feeling, okay? So when we test him, we're going to do 3 trials, and he has to get 2 out of 3, right, for it to be intact, okay? So first we're going to be testing if he feels the dull side, that on the ulnar, or if he feels the pointy side. Okay, so you're just gonna keep on switching on and off. You can do whatever you want. Okay. Just as long as he gets, if he gets the point right or the dull side right. Okay. Did you have any questions?
You said ulnar
and just the
3
ulnar.
times.
Yeah,
Okay.
ulnar 3 times. We're just gonna be testing the ulnar right now.
On his right.
On his right. Okay. Which is the effective hand. Okay.
Okay.
Okay. Right. Go.
Alright, Ezekiel. So what I'm going to be doing is testing your right hand on this part of your palm, just to make sure you can feel some sort of pain. So what it feels like is just I'll grab your unaffected arm and it'll just be something like that that's more dual and more sharp. Okay. So I'm going to have you close your eyes. And then let me know if you feel it dual or sharp.
Dull.
Okay. Sharp. Okay. Sharp. Okay. So you got 2 out of 3. So you got 2 out of 3 correct, which is your pain is intact, which you can feel things. Can you feel pain when something
Yeah,
is
I
in
have a lot
red?
of pain. I can feel that.
Okay, perfect. So that will conclude our session.
Thank you.
Alrighty, Jeanette. So here we have our client Ezekiel. What we're going to be doing is a stereogenosis screening for him, just to make sure his sensory is all intact. So what he needs to do is get 4 out of 6 right. You can present him all of these items
Sounds good.
and have him look at it, feel it, and then on his affected arm or hand, he will, with his eyes closed, he will let you know what the object is by just feeling it without it looking.
Okay. Okay. Hi Ezekiel, how are you?
I'm doing good.
Okay, good. So today what we're going to be doing is we're going to be testing on how you perceive objects in your hands, okay? So I'm going to present these objects to you. You can, with your left hand, you can have a feel of what these objects look like and feel for what they are. And then after we do that, what I'm going to be doing is we're going to be closing your eyes and then you're going to be conducting the test, okay? Did you get a good feel?
Yes.
Okay, good. So now I want you to close your eyes and I'm going to place the object in your hand and you have to guess what they are, okay?
Chopstick. Sauce packet. Eraser. Key. Coin. Pencil. Pen.
Okay, you can open your eyes now. So you actually did really well, Ezekiel. You actually got them all right. This was just a test to see, again, what we said earlier, just to see if you can perceive the objects without looking. So when you're looking for change in your pockets, you're able to feel for it without looking at it. So you feel like you have no problem with that, right? It seems like it doesn't.
Pretty easy.
Yeah, pretty easy. Okay, that's really good. Okay, good to know.